Hey, good morning, everybody, and happy Sunday. So we're at our second go round of trying to have our last session here. I'm sorry, in the world of technology and everything that we're going on, internet connection wasn't that strong yesterday, but we are happy to be here this Sunday morning with my very good friend and colleague on the Norfolk City School Board, Dr. Noelle Gabriel, who represents Super Ward 6. Good morning, Dr. Gabriel. How are you?
Good morning. A little tired, work last night, but by the good graces, I'm here and I'm happy to be joining you this morning.
Great, great, great. So we have a lot to talk about today, and I know, like you said, you just finished work. I think you said about 2 o'clock in the morning.
Yes.
To this day, you still amaze me. I mean, like literally superwoman. You're out dealing with patients every day. You come home, you have a family, your mother, serving on the Norfolk City School Board. We truly appreciate you, Noelle. And great, we have folks who are pouring in questions and comments. So just to kind of lay out the lay of the land, I guess, for today, please, if you're watching us on Facebook, you're watching us on Periscope, or even on YouTube, you can put comments and questions into the chat session, and we will revert back to those throughout the session today, to give our opinion. And again, I want to go ahead and give this disclaimer. Dr. Gabriel and myself are representing ourselves as individuals on the Norfolk City School Board. Any expressions that we have for today are not expressions of the board in any official capacity, but as board members and leaders within our community who represent constituencies. Whether you agree, Dr. Gabriel?
Yes, I would agree.
Okay, so let's go ahead and get started. I'm gonna shift in and bring in the screen here because I think the biggest thing that many of you are probably paying attention to is, of course, we've got a lot of things on the horizon. There's a new vaccine that's been with Pfizer, and I think there's one more that's been given emergency approval. And so we'll talk a little bit about that this afternoon or this morning. And we'll also, really big thing, I guess, as you all have seen, we've had a work session, we had a business meeting, and we've been talking about revisiting the decision that the board made on October 21st in regards to our return to school plan. And what does that look like? So, Dr. Gabriel, I'm going to switch out here in just a second to bring those up in here, but definitely anything that you'd like to add, you're more than welcome to do that right now.
No, thank you again. I'm glad that we were able to connect this morning because I think there's a lot of important information for all those tuning in. Thank you. And then for those who might be tuning in later on or coming back to watch it, I hope that you find this session very informative. As Carlos said, this is a very, very busy time for me. And so I'm not able to be on Twitter and Facebook as much as I want. And so these sessions are really great to provide some information to you all from our perspective on how things are going within our school division.
Definitely. And so bringing that up, cool. All right, you guys are seeing that, and one of the technology just in the presentation mode for everybody, so we can kind of look at that. Well, it's going in backwards mode for you guys, so let me kind of move through all these slides right quick. Let's go back. All right, so yeah, all right. Okay. So I think here we are. All right, so I don't know, Noel, you want to take the lead on this one? Or
sure, I'll go ahead and take the lead on this. Okay, so back in October, the board had a very good discussion about, what did we want to do? I'm sorry, this was back in the summertime, actually. What were we thinking with regards to bringing students back into school and staff members into school? And just to put it into perspective, we have about 29,000 students, almost 30,000 if you count our pre-K children. We have about 5,000 employees. 3,000 of them are classroom teachers. And so we have to put into context students and staff. And, at the height of when we had our meeting, we were at our peak as far as tests becoming a positive and our transmission rate here just in Norfolk alone. And I think we made a very wise decision to only allow virtual learning to take place and would only go back to in-person learning if we had the red zones out. What's highlighted here, circled in red, as the lowest risk of transmission and the lower risk of transmission. What that says in plain English is we're not going to have children and teachers in classrooms unless there is the absolute lowest risk of transmission of the coronavirus. I think that was smart and wise, both because, we're concerned about children spreading virus, but then our teachers and staff members becoming infected and then possibly ill with the infection. Now, since that time, it's, since July, we've had several months of research and data. We've been able to look at other schools that have opened up, both private and public. We have a database now that looks at outbreaks within schools. And there is some very good evidence that shows that, because schools are taking this so seriously, and because school leaders are putting together the mitigation strategies, which are, if you look, it says ability of the school to implement 5 key mitigation strategies. It's the third row down, because schools are taking all of that seriously. And some schools are requiring questionnaires before students come in, and other students are taking temperatures. And parents, this is really important, folks, parents are keeping their sick children home. That's very, very critical. Because the schools are taking this so seriously, I think that what we've seen in the research thus far is that schools are not a hotbed for viral transmission. What that means is, if I come to school and I'm sick with the coronavirus, and I don't know it, let's say I come to school and I just don't know it, and I'm in a classroom with 25 of my peers separated between 3 and 6 feet apart, the chances of me spreading that disease to my classmate Carlos, who sits right next to me, and to my teacher, Mrs. Such and Such, it's low, because we have the masks in place, because the desks are spread apart, because they're sanitizing in between classes, et cetera, et cetera. And so that's good news. However, for Norfolk, what we have to take into consideration is, not just the factor of implementing the mitigation strategies, but what are the Norfolk demographics? If our kids do get sick, what does that look like for our Norfolk community? If our staff members get sick, do we have substitute teachers and long-term subs and other individuals to come in and essentially take their place while they're out for, at minimum, 14 days. I know they've talked about bringing that down, but what does that look like? Bus drivers, transportation. And so that's where we were. Where we are now, right now, is so sad. Our nation is dealing with so many individuals who are losing their lives. Very critical outcomes for those who are ill. Our hospitals in certain parts of the country are being completely overwhelmed. I cannot underestimate the stress on nursing staff members and our hospital personnel. It's serious, folks. It's serious. Even hospitals in our own area, and I will not name them, they are now reaching capacity with regards to their staffing. So some of them may have beds, but the staffing just isn't there, because nurses are getting pulled away to other parts of the country in order to help where they are having the surges. So I just can't underestimate that enough. And so the conversation that the school board is having right now is really focusing on 3 different motions. And I know we're going to talk about those, but the 3 different motions really look at, how do we feel about the core indicators? Do we want to stick with those? How do we feel about the secondary, the indicators for decision making? And then the second motion is in regards to, do we feel comfortable sending children back to school when you were in the yellow zone? And then the last motion talks about, when we transition students in school, how much gap time do we want to have in between the first phase of kids, and then the second phase, and then the third phase, and then the fourth phase? All really critical. I'm sorry that was a lot, Carlos, but there's so much to discuss here, and I want everybody to have a good understanding about it. I guess it's just the clinician in me. I want everybody to know what they're getting into.
So and we're getting some great questions in there. I think you kind of addressed some of those there. And so I do see the comments, and I appreciate you all if you definitely continue to place those in there. But let's go ahead and just kind of take this. I'm a big picture person, and then I also like to break things down. And so, like you said, it's a whole lot. The board took a decision on October 21st And we had a lot of discussion. I think it was almost a 7-hour meeting discussion about this, but this was an important topic. And we not only talked about, what the core indicators would be, we talked about, we gave individuals the ability to have the asynchronous Wednesdays for teachers and students not to have to be on a Zoom call for that particular day. And then we talked about, which really took a lot of time, was talking about the phase-in, who would be in that phase and how much time we would have between that. So the motions that we have here, which are really 3, and we're going to address each one. This is motion 1, I think, that you were talking about. This one is motion 1 that we'll take up for consideration on Wednesday, is move that the board revises its decision from the October 21st to support a return to school plan based on the status of 3 core indicators recommended by the CDC, indicators for dynamic decision making, which includes incidents per 100,000 persons within 14 days, and percent positivity during the past 14 days, and the district readiness for implement key migration strategies as outlined. And so this was kind of an interesting one here, and I'll kind of show you what the district is looking, well, if we do this, what this looks like. So I'm going to bring this up full screen so you all can see this. And so essentially what we have in that, you see that red zone that's around that. Right now we're at the lowest and lower risk. And that's what the board decided on. And rightly, we've heard, the paper has reported, others have reported that Norfolk took one of the most conservative approaches to this. And really, this was not, it was based on many different factors. We're not only looking at the safety of our students, but we also have to take into account for the safety of our staff members. And then also there was about community. And I think I was shared in a report from Wavy TV 10 in regards to saying that, we're not the NBA bubble. Well, it was true. We're not the NBA bubble. There are a lot of different things that are put into that. Our kids and our teachers aren't set in the same environment every day. They are actually leaving and going home and coming back. And so my concern wasn't what was happening inside the school. The concern really began to go around what could potentially happen in the times of transition between school and home, back and forth on these daily basis. And I think that we're starting to see that. We're seeing that in some of our other school divisions who have done some in-person and who are now going back to full all virtual, now that we see the numbers are so very high. Not saying that there's a huge spread within the school building itself, but then we start looking at everything that's going on outside in the community. So this first motion will really take us to a place where we're shifting from this green zone to shifting to adding in the moderate component of that. And so when we began to kind of look at being in the lowest and lower groupings there, now we talk about adding in this moderate. And so I know that you're getting back with this there, Dr. Gabriel kind of dropped off a little bit, but what is the moderate? What's the major difference between the lower and lower and the moderate?
Let me, hi, Carlos. I was having, I'm not sure what happened, but you can hear me now. Okay, so I'm coming in through my phone. Let me try to reconnect for just a second here. Connection.
All right, no problem.
See, look, you were having issues. I know that Verizon is laying down some wires. I do know that because I got a message from the next door. Okay, hold on a second. I think here we go. Broadcast studio. Okay,
there
let
we
me
go.
leave this one.
So I'll bring you in on the other one. There we go. You back? All right. Look, we'll keep it moving. It's, stuff happens. So what's the major difference between the lower and lowest, the green, and moving to the yellow, which is the moderate risk?
Okay, so what that means is that, so right now it looks like when I looked at the rates the other night, we were over 10% positivity. So that means 10% of every 100,000 patients testing were becoming positive. I might have pushed that level over a little last night because I had some positives that came back. But but the yellow zone, and it's clearly yellow. The yellow zone says that we would accept anywhere between 20 to less than 50. What that means is that, we would accept that. And we can talk about that a little bit later, but that's what that means right there. And I have some thoughts on that, but we can discuss that a little bit later.
Okay, definitely. And so, and I have some other folks that are coming in, and definitely when we get through these slides here, we'll definitely address those questions. I want to go ahead and go to the next one. This is the secondary indicators. So many folks, like, we have those top three, but then we have secondary indicators that we agreed upon that we would also take in consideration that came from the CDC. Now, mind you, all of these are CDC recommendations for dynamic decision-making when it comes to return to school. And so we had these particularly secondary indicators, and there was percentage per change, so that was taken in, the number of hospital beds that were occupied, percentage of intensive care unit beds, percentage of hospital inpatient beds, and then it had an existence of a localized community public setting COVID-19 outbreak.
Right.
And so the next motion that we have for consideration on Wednesday is this one, which is move that the board revise the decision from its October 21st to direct the superintendent to begin phasing in identified student groups when case indicators per 100,000 and percent positivity are in the moderate risk level. So that was that yellow that we just saw. And then it's got yellow, respectfully. And I guess I'll have you talk about that in just a second for Norfolk within the context of the Eastern region. And when NPS's district readiness indicator implementation of all 5 mitigation strategies is in the lower risk level, like green. And for a lot of people, I just want them to know that our district and our superintendent it's taken a lot of time, and they put together an extensive plan for how we will return back in school. A lot of the discussion has just been really from the board level, how much risk we want to take and where do we want to set that threshold to begin that particular process. So I want the community to understand that Norfolk Public Schools is prepared for when we're ready to move back into in-person learning, to be able to mitigate that, to be able to make it as safe as possible. But I guess the deliberation piece that has happened on the board is really going back and forth about where do we see that level of risks that we want to take as a board, as far as within our populations, both not only students, but also looking at the adults who are in those buildings who are supporting those students every day. And also recognizing the fact that everybody that works in Norfolk Public Schools, though we would love for that to be the case, they don't all live in Norfolk. They live throughout Hampton Road. So we have to take a more holistic approach to that, not just in our city. So Dr. Gabriel, I know that we kind of have a little sense. What is this yellow and yellow perspective versus the green and darker green that we had?
Okay, let me just take for 1 second. And now that I'm looking at this, and again, I did work overnight, but October 21st, we made our original motion for in-person learning back in the summertime. So is that October 21st when we revisited and said that we would be going back to virtual Wednesdays? I'm trying to go back and figure out.
I think October 21st was actually a work session, and we did make a decision about the asynchronous Wednesdays. But I also believe that was the discussion that we had about the phase-in as well, and with groups. It was a long one. We had a work session, and then we actually came back after the meeting.
Okay, I have to go back and look and see exactly the decision, but I know that we made the decision for virtual learning, during the summertime. You're right. Yeah. Okay, so right, and also what I'll say is, we are following the CDC indicators for dynamic decision making, which is evidence-based. We are in constant communication. When I say we, I mean Dr. Birdsong and her staff are in constant communication with Dr. Demetria Lindsay, who is the head of the Norfolk Health Department. And so guidelines are being discussed and followed as it pertains for the Virginia Department of Health and the CDC. So there is clearly evidence-based decision-making being done with the decisions that are being made. Now, when it says here in this motion, moderate risk level, yellow and yellow respectively, I'm not sure exactly what that means, because on the dynamic decision-making chart, there is a yellow zone, and then there is to me, it looks like orange. And I'm not colorblind, but it looks like orange. So I think we just need to be specific and say, are we talking yellow, or do they mean yellow and orange? So that's one of the questions that I have when we come into our meeting for Wednesday. And then and I have reached out to our chair. It could just be a simple innocent mistake that's been written here. And then the other item here where it says within the context of the Eastern region, I wanted to get clarity on that as well, because as you shared earlier, we're really looking at the Norfolk community, because really the percentage of disease burden that we might have in the school would be coming in from the community, from the students.
And while you're still speaking on that one, Dr. Gabriel, I'm going to bring up actually the health metrics so that people can get a visual of what Norfolk looks like today.
Okay.
So you continue to speak. I'm just
right. Okay. Right. And I'm not saying that children are, coming in and infected and that's what we're concerned about. But I'm saying that I am reiterating what has been said over and over again by Dr. Fauci, by colleagues, is that the spread of the disease is very prevalent in the community. But what happens is when those community members start to enter into our school buildings, sometimes they can come in asymptomatic, or children might come to school not feeling well. And so that's why we have to really look at the Norfolk metrics for when we look at making our decisions.
Yeah. Okay. Actually, there we go. I wanted to bring that up for just a second, because I think that's important for people to kind of look at what we're talking about. And let me see if I can bring that up for everybody. All right. Can you see that? Great. There we go. So I'm going to scroll down here to this particular school metrics. I think it's actually pulling it from another screen. Wonders of technology. There we go. So this is the CDC guidelines. And actually, that's not the one I want. I wanted to actually show you all. I'll come back to that one in a second. It's not showing here now, but I wanted to show everyone the one from the Virginia Department of Health in regards to what it looks like in Virginia right now. Because I think it's important for people to kind of see that color. And why we talk about certain things.
Right.
But
and I don't think anybody, I don't think anybody right now, and okay, so I'm just going to say, just speaking for myself, I don't feel comfortable sending any students or staff members back while we're in the orange or the red. And that's where we're in the red right now, just to be clear. And so, there's no motion on the table right now to have any students going back in right now in the red zone. We had discussed in our meeting about our self-contained students and our ELL students. I think that our plan was to pick up that conversation because there was some confusion about would these students fall into the metrics that have been disclosed, shared by the CDC indicators of dynamic decision making. And I think we needed to come back to it because, this is a every day there's new information here for us to consider with regards to school reentry.
Definitely. And so this was that particular piece. And I wanted everyone to see that essentially also this motion talks about getting rid of the secondary indicators. So this is what we had in the first group. And so now we won't be looking at the secondary indicators, but we're just going to look at the top three that we had before. And I think it's a great point that you brought out, Dr. Gabriel, that we're not talking about rushing back into school today. And I think that we have to put that into context. We're saying that when we deem that we've kind of come off of this third wave plateau, what is the level that we're saying that we want to move into? Is it still at the green? Or are we saying we want to now mix in a little bit of the yellow? That's an important piece for people to take into account. And also I have to reemphasize that we're not taking away parents' authority and their right to make a decision for what they feel is in the best interest of their child. Meaning that if you want to, we made this decision at the beginning, and I think this is what you were alluding to when we talked about with the Virtual Scholars Academy. If a parent chooses to decide to keep their child at home for the remainder of the school year, we have already made accommodations to be able to do that through the Virtual Scholars Program. Right now, all of our students are in the Virtual Scholars Program, but if we get to a point, whatever we decide, if we move from the green or we move to this yellow, whatever that decision is, ultimately the parent has a final decision and a say-so to say, no, I want my child to stay home and continue virtual learning. You have that ability. And,
Right.
I think that's important. I think sometimes in the discussion it gets lost. But ultimately, you have the final say as a parent. If you're ready and you're comfort, like I remind people, I don't have just 2 kids in Norfolk Public Schools with my niece and nephew that are still there. I got almost 30,000 kids that you and I both share that are here, and all of us that care about. But I know that my sister has said to me, she's not comfortable, regardless of when we move that health indicator. She probably won't get a comfort level until next school year. And she said that, both my niece and my nephew are doing quite well and thriving in their virtual learning environment. And so I just want parents and anyone who's watching here to know that whatever decision we make, you have the final say whether or not you want to keep your child home or if you want your child to be able to go back into school. And I think that that's just important for people to hear.
Right. And, every school division is doing it differently. And let's just look at our 757 neighbors. So Chesapeake, they're going to school 5 days a week, even when they are clearly in the red zone. Virginia Beach, they have a little decision tree based upon the colors of the metrics. They are not entering school when they're in the red zone. They have just pulled out their self-contained students from entry, and when they go to school, they're going 4 days a week. For the elementary kids, there's not a hybrid version for them. So you're either 100% virtual or you're in the classroom. Teachers aren't balancing between paying attention to virtual learners and in classroom instruction. Portsmouth has a date that they looked at as far as when they're coming back to school, and now they're kind of looking at some of their metrics to see. And so everybody is a little bit different based upon their divisions, demographics, and what they feel is best for their division. And that's okay. That's what the governor and that's what officials have basically said to school divisions. Hey, we'll give you some outlines, but it's up to you with what you want to do. And, sometimes we say, let us do our own thing because we know our division best. And so this is what we're discussing. Let me see here. I see some questions coming through here too.
I think we kind of addressed this one in my last one. This Miss Larkin is mentioning, she says, why can't we move to the yellow metrics for in-person school while accommodating for those teachers and students who want to stay virtual? Why can't we allow families to opt in for that? And I don't disagree. However, I have to point out, and I think that Dr. Gabriel, you probably know where I'm going when we talk about teachers. That's a challenge that we have. And I want people to understand that with the virtual Scholars Academy and when we move in, we don't have a large teacher workforce enough where we can just have teachers who stay home or teachers who are in person in many of our cases. And I think this is where we have some challenges when we talk about the hybrid, that some students would still be online. We'd have these cameras. And they would be able to see their teacher instruction in the classroom while that teacher would also have some students in the classroom. So we may have some situations, but we can't accommodate that for everyone. And that's the struggle that not only Norfolk is looking at, but every school division. When you look at that, Newport News had to make a complete reversal because of that same challenge. And that was staffing and making sure you had teachers there. And we have a very good relationship with both of our teacher unions and working with them and communicating with them in an ongoing communication to find out what they feel is acceptable, because we have to look at that. Virginia Beach did a hazard pay, remember? Because in respect, you have teachers doing additional duties and things of like wiping down and cleaning. And there's a whole lot of things that go into this than just one thing, and that we are balancing. And I'm not just saying that myself and Dr. Gabriel, but all of us on the board, our superintendent and others are trying to balance to find the right mix. So that was my take on that one.
Right. And I think that many of us are becoming a little bit more comfortable with the yellow zone because of the fact that we do have a vaccine that has been approved. There is research that is showing that because schools are taking the safety measures so seriously, the risk of transmission is very low. I think that comfort level is also being noted from our staff as well. And so, the comparison that I'll make is, if I have a kid who I see in the office who is obese, and I tell them you need to lose weight, but yet they don't have access to a good grocery store and their neighborhood isn't safe for them to go out and exercise, I have to think outside of the box, well, what can I do to help this child in order to get to where I need him to be? And so for us, we know that we want kids in the classroom to learn. The teachers want to be in the classroom to learn. Parents want them in the classroom to learn. We hear that. But the thing is, how can we do that so that our teachers feel safe and aren't going to leave us, so that they're not going to be stressed, and so that we are protecting our children and the families that they are going home to. So it's big picture for us, and I appreciate the feedback that all of the parents and others have really shared with us. We have to look at all sides, everything, because that's our job as board members.
Definitely. And I have another one here. So see Ms. Barnett placed in here, and I know she corrected it to say VDH recommendations are to reopen schools in the yellow metrics. How did you choose CDC metrics over VDH? And I'll add an element, because I think I was one of those who was really stressing it. Dr. Lindsay came to us. And just because we have Virginia recommendations for the entire Commonwealth, she stressed the point that it is a local decision based on some of the additional secondary things that are in your community. And one of the things that we looked at, as I argued and debated in respect of placing forth that argument, that you can't compare Norfolk to Virginia Beach or Chesapeake. It's apples to oranges. Yes, they're both cities, but Norfolk's an urban school division. We have a higher rate of reduced school lunch, which is a significant sign of poverty within in our communities. And all of the studies, all of the information that's showing come across the country is saying that individuals of color, individuals who are in these distressed situations already, are adversely affected at a higher rate with this particular pandemic than others. And so when I went in, and I know that for putting forth the argument was to say, hey, we need to take that in consideration, and maybe we need to take a lower risk than just the yellow because of the population that we greatly serve. And I don't know if you got anything to add on that one, Dr. Gabriel, but I know that's where I was.
The board made that. The board made the decision. Yeah. I mean, the board can make the decision to use no metrics at all. And so, honestly, how do we choose CDC metrics over VDH? We just went with the CDC indicators for dynamic decision making. Yeah. It was very clear. There's really not that much difference, but it's, as far as a recommendation is just a recommendation. It doesn't mean that you have to do it. And every school division is doing something differently. Yes. Let's see. I was going to say something else. What was I going to say? Anyways, go ahead. Continue. It'll pop back in my mind.
The messages, so I'm trying to get them to at least show up as we address those there. And I know we're here. One of the other things, and you mentioned, Dr. Gabriel, is that, and I think it was as of Friday. So we finally have a vaccine that's that's been approved for emergency. And I do believe we also received notification from the Virginia Department of Education that our teachers will be considered essential frontline, and they'll be in phase 2, if I'm not mistaken, of the vaccination process. And this does change a whole lot. And I think we've had this discussion before, where I was very concerned because we didn't really have a timeline or a sense of what we have a vaccine, how long will we be in this situation. And so definitely taking a more conservative approach to this in the respect of where our guidelines are. I will even say that I am myself even moving more towards the yellow now that there is a vaccine on the horizon. And that making sure that we emphasize that there is an option for parents if they choose, if we're in the yellow, I don't still feel comfortable, I want to keep my child in the virtual scholars program, that they have that. And so I am leaning more towards the yellow for a time. That doesn't mean, because I'm going to pull the screen up, because right now, Virginia, except for 2 localities, is red. So that doesn't mean that we're opening schools tomorrow. But when we get there, there is a major, I feel that there's some light at the end of the tunnel. That doesn't mean that we stop being vigilant. And I think that you can even address that, Dr. Gabriel, that, we still have to continue to mitigate this with the social distancing, washing hands, and so forth, right?
That's right. Look, it's going to take everybody to do their part. If we all want our children in school and our staff members to feel safe, everybody has to do their part. Let me see here, to be monitors in the classroom for Miss Larkin. Thank you so much for the comments. And I know that we need to connect. We already have that, honestly, because even before COVID hit, we had a shortage of bus drivers. And so Dr. Birdsong and her team were thinking of creative ways in order to both fulfill a significant gap that we have with our bus drivers and our school nutrition providers. No, the burden, and this is going to go back to my point, the burden is going to fall on us, the community. And so what I'm going to say to all of the parents who are out there who are writing very good, heartfelt letters to the board with regards to getting kids back in school, it is going to be us signing up to be the substitute teachers, to be the monitors. If somebody has a CDL, which is the commercial driver's license, sign up to be a substitute bus driver. I'm not joking, folks. We need you guys to help. Yes, it's going to be very stressful when teachers come back and they're going to have to balance virtual learning and in-classroom instruction. Okay. We don't want our teachers to be stressed out. We want them to be ready to attend to the educational and the social and emotional needs of our kids. And so, yes, if you have the ability to sign up to be a substitute teacher, to be a classroom monitor, a bus driver, nutrition person, we need you. I volunteer right now in this perspective. We all have to. We have to kind of have the JFK mentality of not, what can Norfolk Public Schools do for you, but what can we do for Norfolk Public Schools in order to really get everybody back to where we want to be. And so that means, yes, social distance, wash your hands, don't transmit disease. And the other thing is, let's everybody have an all-in attitude and say, okay, what can we do to really help? Because the burden is going to fall on the teachers. And frankly, our state government and our federal government do not fund public education to the point where we can adequately address the school maintenance and the salaries that need to be done in order for us to continue with the level of expectation of educational delivery that we have right now. And so that's another elephant in the room that we can talk about later. But sorry.
No, but I think you're right about what you can do. And I think that was kind of also the sentiment that we took when we were talking about the community spread piece. Our governor has just sent out another round of new restrictions. So we've got a midnight curfew till 5 a.m. in the morning. And to be perfectly honest, and Dr. Gabriel, we've talked about this, I think that our governor is being very lenient to try to send a message to folks. Hey, we have another major holiday coming up. And let's be honest, a lot of people did not adhere to the advice of staying home during Thanksgiving. And now we're starting to see, and you're probably seeing it in your emergency room and others, we're seeing this uptick of numbers and they keep going up. Now, we've got the Christmas and Hanukkah holidays are right upon us. And we'll have Kwanzaa right after that and so forth. And so this is another time when we have to put the overall community ahead of, we may have to miss out on a little bit on this particular holiday so that we can ensure that we have holidays to come for the future. And the sooner that we can be able to get to the benchmark, if we change it to yellow or whatever else may be, that we can get back to some type of in-person. But it's going to take a community effort. It is not just on the schools. It's not just on our teachers and administrative staff. Folks, this is a community effort. And if we step up and if we can remind our family and our friends to adhere to the guidelines that we have in place, the sooner we'll be able to get our students back in class. Because I've been reading the studies. Trust me, I read all this information and the letters just like everybody else that comes in. And our most vulnerable students, some are students of color we're seeing that there is some slippage that's happening with not having this in-person learning. The sooner we can get that, it's going to really rely on the community helping us get these numbers down. And now we do have a vaccine that's on the horizon, but there's also a sequence of that. We're not going to, I think from the information that we heard was probably not until like the summer, where everyone will really get an opportunity to who wants it to get there. And there's a whole other thing that we have to talk about at some point. And I've brought up to the superintendent and others in discussion is now that we do have a vaccine, are we going to require teachers to have the vaccine? Is this going to be a new requirement for the vaccine for students? Like they have to have their vaccination to go back to school. So there are a whole level of other discussions that it's not either or, that we've got to begin to start having now. And is this coming from the Department of Education? Is it going to come out of a bill out of the General Assembly? They have session coming up in January. There are a lot of other things that we've got to put into this juggling act as we're trying to move things. So
right. Did we miss it? Were there any other questions that came
yeah,
up?
I'm actually trying to get through that.
As well as those who are doing well. Yes, that's
Yeah.
true. That's true. And
Yeah.
and I will tell you, a lot of the families who are doing well with virtual learning, we don't hear we don't hear from them because everything's going well. But when I see children in the office, I ask them specifically, "How are you doing with virtual learning?" And I will tell you, there are a lot of families that respond and say, "You know what? It's not ideal, but it's what we have to do for right now, and we're making the best of it." And so I can definitely understand the struggles that the families, especially with our working families, who are having to juggle the virtual learning and the in-home childcare or the YMCA childcare that they need in order to both balance employment and doing what's right for their kids. And I will tell you, and Carlos, I feel like you would share the sentiment. I'm 100% committed. Once we have the virus, the rates are down, kids are back in school, whatever it takes for us to get our kids back on track, so that they are reading on benchmark, doing what is needed. I think all of us are prepared to have those very important conversations, whether that means extending the school year, extending the school day, allocating more funds for those things. And that's when we're going to need the community to support us when we go, when we ask for funding in order to address those items.
I'm reading this one here from Cheryl Lacey, and she's saying the problem is that central administration is telling you about being ready with PPE, and that may not be correct. We don't have enough PPE to last the rest of the school year. The only plexiglass is in the front office, and check to see if we have enough. And and honestly, I will say, Ms. Lacey, you're not the first one to say that to me. And I'm not quite sure what you've heard, Dr. Gabriel, but we purchased a lot of that PPE with the CARES Act funds. And as you know, Congress is essentially leaving without another bill in place for funding for these items. And so this will become a challenge. This will be something that we'll also have to take into consideration as we move into the next half of the school year and then the beginning of 2021, that additional funding. We do have a new administration that's coming in. We'll have a new Secretary of Education and so forth, but it is no doubt we need to have funding from a federal and state level to be able to support public education instruction and making sure that the learning environments are safe, not only for our students, but also the staff members who are working there each and every day. So we'll continue to put that pressure there. We'll continue to ask those questions of our administration. And I intend to and I know that some board members have gone and to ask to go in and take looks. I want to see it with my own eyes to make sure that I can say with confidence to the community and others that we're ready. And I say that, I believe in our superintendent, but I do believe now, just based on listening at that one, I'm probably going to speak with our superintendent about, can we take some views just to reiterate that for folks, because we're that sounding board, we're that voice piece, right. And we want to make sure as school board members that we can say without a doubt, confident, show you a video, whatever else down there, that we are standing behind what's being said to the community to ensure safety. And I don't know what you would have to say to that, Dr. Gabriel. We've known each other for a long time, so we typically on the same wavelength.
I mean, no, you're right. But I'm going to have to just say this to the community also. Norfolk Public Schools was very generous when we were at the height of this crisis, and hospitals were literally trying to open every door and every drawer to find a mask and a gown. Norfolk Public Schools donated some PPE to some of the Norfolk hospitals, CHKD being one of them. Virginia Beach Public Schools donated their PPE. We weren't sure what was going to happen, but they wanted to make sure that the medical providers had what they need. I was going through periods where I was having to reuse gowns and wear a mask for 5 days in a row. That's not ideal. Again, that's what also contributed to the decision that was made early on about, staying with virtual learning. But now, hearing comments from Ms. Lacey and possibly others, there is a chain of command. We got to run these up through the chain of command. Dr. Birdsong cares deeply about the health and safety for all of our children and our staff. And if there is an issue with PPE that is not that it's not getting to the teachers, or there's concern about not having enough, trust me, she will want to hear about it and she will address it right away. I have no doubt that she will be on top of it. Her and our head of facilities that's in charge of that. Okay,
something
let's see.
about schools not being consistent with policies and procedures across the board in a normal situation. So how do we get them to follow safety measures in the same way in every building? I know that we've got new leadership that are working really hard. We have dynamic school level leaders who are working along with their assistant principals and so forth. And just because we don't physically have students, I know that they're working every day to ensure what those protocols look like, that individuals are following that, and many people may not understand this. So, we are very transparent as opposed to whatever news article may have come out a couple of months ago saying that, Norfolk wasn't releasing their COVID, positivity rates. That's not the case. We actually do that on a weekly basis. And I think that we just got a report that we had 10 cases, 8 of them were staff teacher members, and 2 of them were students. So this is where I say to folks, all it takes is one. And if we don't put the proper mitigation in place, that one can begin to affect others. It's a domino. That's what this virus does. So when you look at that, we are having those things already occurring right now without a full population of students in school. So this is, again, when we kind of talk about those level of concerns. But again, we're at a higher rate. So if we get down to a lower rate and we open up to be able to have schools, students in the actual buildings, then we're in a situation that we can control that and manage that a lot better, right?
Right. And I would say that, yes, policies and procedures need to be consistent, and we can bring that to Dr. Birdsong's attention.
Yep.
And if there is a specific example, you can always email us and we will share that with Dr. Birdsong. That's the best way if you have specific examples.
Yep, exactly.
Mm-hmm.
And we do have that, and I'll put this up here. And I know, I think you may have ability to do that as well in the comments. But if you're following, I know that Dr. Gabriel and myself both were on social media. So if you want to send us messages, leave comments, we're going to follow up, send emails to us. Yeah. We're both NPS alums, we're proud alums. Even though we went to opposing high schools, we're still good.
And I would say if folks can send them to my email, because right now, since I am working almost every day, I am not the best with my social media right now. So I'm asking for grace on the social media, but I do check my email. So if they can send it to my NPS email, that would be very, very good. Yes, it's ngabriel at nps.k12.va.us.
All right, so I am actually dropping that in the comment section for folks, and you should get it now. So feel free to definitely send us messages and so forth there. And we appreciate you guys just knowing that Noel and myself team up to do these types of things because we want to be transparent. We want to connect with the community. It's really hard right now. We can't go to your public meetings. A lot of people aren't having those civic meetings and so forth. And so this is a way that we feel that we can reach out, we can answer questions, and we can stay connected to the individuals who not only voted for us, but our community. We want to hear from you. We didn't run to serve on this board because I tell folks all the time, not because I wanted a title, and it's definitely not because of the pay. So
what pay?
We do this. We really do this out of the kindness of. We do this as a way to just say, hey, we appreciate you, and we're fighting for you each and every day. And we're not saying that our colleagues aren't, but this is our way. And I will have to say that we do have another one of our colleagues. We can't have her up here because if we did, we would have an official meeting. So, but but I want to call her because I say Lauren is the dean of our board. She's the most seasoned member, not necessarily on the school board, but in education as a whole. But she's always there and she's advocating as well. And we could have her up here, we would. But I know that she's watching and placing things in the chat there. So we're just going to continue to go through these questions for the remaining portion.
Did we get to the last motion though, Carlos? Because
you know what? Let me go back to that.
We need to get to the last motion. So we've broken down the first motion. Really is looking at just keeping the core indicators and monitoring the secondary indicators, but not necessarily having them as guidelines, which I'm okay with. I think that that's perfectly fine. And again, that is evidence-based. The second motion deals with what I thought our conversation was at our last meeting was going into the yellow zone. So that means accepting a transmission rate of between 5 and 8%, which right now, I don't think we're going to be in that area for quite some time. Probably by the time we roll into the yellow zone, we'll have vaccine rolling out to hopefully our secondary groups, and I think that we'll know more and be ready from a technological standpoint within our school building in order to accept students. So, I, like you, feel that when I look at risks and benefits, I feel that the moderate zone. I feel like that is I'm more comfortable with that right now as far as safety goes. I'm always going to put safety as the hierarchy. I can't tell you guys. I have been at the bedside. I have pronounced individuals deceased. I have resuscitated. I have delivered bad news to parents. I don't want that to happen to a single individual in our schools. It's horrible to think about that. But now the third motion speaks to our transition period.
Yeah.
And initially, when we discussed this, I had put in for a recommendation of 3 weeks, only because our testing capabilities were not that great in the area. So children, we would get a response anywhere between maybe 5 days or so once a nasal swab was done. And that's assuming that the provider did the right nasal swab, which there's a whole lot of teaching going on right now within the medical community about what swab are you doing and are you doing it correctly? And so, I wanted to make sure that if a child was sick and if they needed to get to a provider, they had access to a provider, a test came out, they were tested, and then they got results within a certain amount of time. That was my logic with the 3 weeks. But I know that when we discussed it with Dr. Birdsong at the last meeting, she was thinking about transition time, both to accommodate for transportation and I think parental notification. I mean, she was just honest with the board. She was like, if you're asking for my opinion, which she appreciates, I mean, she's the one that's running the operations. She said a 3-week transition would be possible. So I am a little confused when it says, to adopt a 2-week transition. I think we're going to have to clarify that when we come to our meeting on the 16th.
Yeah, because we had this one, because this was actually one that I was engaged in the back and forth with, because I said 3 weeks. I wanted to keep it at 3 weeks. I think it gave us enough time, particularly for those items that for which the superintendent had mentioned before. And the chair asked the superintendent's opinion, and she said the same thing. She would like to keep it at 3 weeks. And so I'm a little shocked that I'm seeing 2 week here. So I will definitely ask for at the meeting to ask for clarification. But if this is the case, I'm probably going to vote no. And to maintain what we have on the 21st. And that's just based off of making sure that not even just testing or whatever else, but based on the recommendation of the superintendent, they're the operations side of the house. I think the other piece was somebody had said, can we address the hybrid learning? And there was concerns around that. And there's still concerns around the hybrid learning. And I think that we're going to continue on our original motion on the 21st. We did direct the superintendent to continue to look at and direct her staff to look at new models and to look at how we can perfect the hybrid model to better serve. There's a challenge right now, and that is I've heard across the country, and I've been, I'm in constant contact with other school divisions, other educators, individuals that I know from, just my experiences and just saying, hey, they're doing this hybrid learning, and they talk about the challenges. And one of my greatest ones has been, you have a group of kids who are online, you have a teacher that's in person, you have students that are in the classroom. You're trying to make sure that the students in the classroom are doing what they're doing, as well as the students that are virtual. Now, this is not uncommon for college level. I mean, there are a lot of classes that you can take college level like this, but we're talking about high school, middle school, maybe high school. We can, get it to a certain hammer, but middle school, definitely, I just don't really see it in elementary. And that's why those groups are first to get phased back into some type of in-person. But I just have some concerns around that. And I don't know what you'd like to add to that, Dr. Gabriel.
Yeah, that's on the hybrid learning model. I think that Dr. Birdsong did what she thought would be best in following the CDC metrics with regards to, the board said, what can we do in order to get children in school? And so she proposed the hybrid learning model because the other items that when they were looking at the out of box thinking, you know, do we just send all elementary kids to a high school? Can we go 5 days a week? Can we do a morning shift and an afternoon shift? I think when she, you know, works with the Dr. Lindsay and the public health department and other health officials, you know, this hybrid learning model was what she came up with that really keeps in place the mitigation strategies, which if we're serious about not transmitting disease, this is what we have to do. If we do like some of the schools that have had outbreaks where they don't require masks and they keep desks closed and things like that, then we'll have a different problem on our hands. I think that, you know, I know we talk a lot about teachers here, and that's not to say that we are dismissing parental concerns, but if we don't have the teachers, we don't have instruction going on. And so for teachers, there is a high level of stress with regards to, number one, the technology, learning the technology, feeling comfortable with the technology, and then being able to implement both tending to the children in front of them that's face to face, and then the children that are on the monitor with them. And, you know, you're doing a juggling act at that point in time. I think some can probably excel and do well with it, but I think others, it's going to be a really high learning curve. I mean, even for physicians, when we had to go to telemedicine, there were so many glitches that had to get worked out about, just doing that. And, you know, as one of our former board members used to say, it's driving the car and changing the tire at the same time. And we have to give each other grace during this period and just really allow our teachers to share their concerns because they are the boots on the ground. We always like to hear from them, right, when we're in our meetings. And they're going to tell us, you know, what's going to be working well for the kids and what's not. I saw a comment in here about social emotional learning. Can we get back to that for a second? Okay. What social emotional support is provided to students, for example, are there? Absolutely. And I will tell you that, first of all, school guidance counselors are not mental health workers. So let's just make that distinction right now. They're great. They can deal with a student who's lost a loved one. They can pull together a group of kids, like maybe military children who have family members that are being deployed, but they're not therapists. And so what a lot of the guidance counselors are doing, and guidance counselors, as you know, which is great, the board last year extended their contract length to go from, you know, the 9-month to I think it's 11-month employees, which was great. That's what they were asking for, so that they could have time to prepare for the things that they need to do. So yes, Ms. Newsom, and thank you so much for all of the strong work that you've done with the Norfolk PTA. You're kind of holding up that end of the burden right there. Yes, our guidance counselors are available for one-on-one virtual connecting with parents and families. At any time, they can request a meeting with them. They, like with my daughter's school, they actually have a session once a week where the guidance counselor talks to them about their feelings. You know, what are some things that you're doing as a family in order to address, different things. And the guidance counselors, I guess this is why kids need to have their cameras on when they're when they're doing the virtual learning, because the teachers are picking up on cues of children who are not engaged. And then I will also say this: they're recommending them to go to their pediatrician. So if there is concerns with regards to social emotional items, send them to their pediatrician. We have the tools and the resources to get families to where they need to be in order to have these items addressed.
Definitely. And I will say, particularly to the about the cameras. I've spoken with Dr. Birdsong, and it's an item that I intend to bring up at our next meeting here. But I've had so many teachers who responded back to me about the concerns about students not having their cameras on. And really, a lot of people wouldn't see it, don't see it in this way, but there's an equity issue. We have some kids who are just, they're embarrassed about their living conditions, and so they don't want to turn on their cameras. But we can't have a child, that teacher doesn't know if that child's paying attention if the camera's looking up at the ceiling all day, or, you know, the kids go over there playing the PS5 or PS4 where it may. So we need to ensure a way that kids can feel comfortable. And so I've researched, and there are several school divisions across the country who are putting up mandatory virtual backgrounds. So we eliminate that issue of everybody has the same background. And so kids don't have to worry about what's being seen behind them. They can focus on their learning. The other piece of that I want to follow up, and that I saw this at another college across the country, and Dr. Gabriel, you don't know it yet, but you will now. But I'm looking at doing a session like this on social emotional help and resources that are out there in the first week when we come back in January for parents. And so Sharice will probably reach out to you because I love to have PTA as a part of that. But to talk about, we've got support at CHKD and we've got what's inside the school, but putting out those resources and just being able to help parents understand, hey, this is how you can identify these things. These are the things that you can do. These are the resources that are out there. So I appreciate that question coming up. And if you guys have ideas for other things that you'd like for us to address, please drop them in the chat box.
Right.
So we'll be following that. These are things that, we're all in this together. Truly, as we're going through this whole process. I know it's after 10. I'm going to try to get through a couple more here. Very worried about
Yeah,
I know you haven't been sleeping. You got kids that are probably hungry.
No, evidence-based is a constantly changing target. Yes, I would agree with that from a medical standpoint. First we quarantine for 14 days, then we go to 10 days, then we go to like, what are we supposed to do? And they're like, oh, just use your best judgment. Okay, all right. A homework assignment for some of our members who are watching here. We need to pass a division 1-to-1 policy that's very evident with our virtual learning that we're in right now. We need every child to have access to technology. We need them to be able to connect. We need them to be able to have a working device that is clear. So we need to pass a 1-to-1 policy. And I know that that's something that you, Carlos, you have that in the policy committee. And our staff need the technology too. They need the big monitors so they can see all of the kids. Yes.
I will say that I was approached by a former teacher of mine who, civic league leader, who really said, hey, we cannot, let's not miss this opportunity to really reshape the way that we do education. I don't think that all virtual is the best thing, but I also think that the way we do education inside the classroom needed to be shaken up a little bit. And so there are some things that are rising up out of this current situation. You kind of see that half glass empty full type of situation, but there are some pluses that are coming out of this. We have overage for grading, kids who, make a mistake and they get kicked out of school and they get behind. We get overage for grade. And so now we have kids who are able to continue their learning virtually. For some, you may see that as, oh, okay, well, that's that child over there. But we're looking at all of our kids, kids, and making sure that everybody receives a quality education. But then we also have to think about kids who can't be in a physical classroom. How can we find the right technology to be able to support that? So we are on the 18th in our policy committee. I serve on the policy committee. We are talking. I know that Dr. Pohl is bringing us the first version of the 1-to-1. We couldn't do it because we didn't have the funding, but this CARES Act fund, again, like I said, this has brought some pluses out of it. We're able to now provide a device to all of our students who need it, as well as there's legislation in the General Assembly and the governor's pushing this about making sure that we close the digital divide by providing broadband across the Commonwealth and our rural areas, as well as in our urban areas, to ensure that everyone has quality internet. As you saw yesterday, trying to do this show, my internet kind of went out, and I paid good quality money for this internet. So, it's all of our children need to have that, and all of our teachers. And that's the other challenge. We have some teachers who are teaching out of their classrooms because they've signed waivers, but they need that classroom. If they're a science teacher or an art teacher, they need to be able to have those type of things to be able to show kids. So please keep the ideas coming. I can't stress that enough. I think that helps us when we're working together. And even the frustrations, let us know when you have frustrations. We're listening, and we're trying to take decisive action.
Decisive and safe action, respectful of everyone, and trying to do what's in the best interest to keep our division moving ahead as best as we can. The gravity of the decisions that we are making right now, I just can't underestimate it. And I'm really grateful that we have such dedicated members on our team that really feel comfortable sharing their thoughts with us. And we have a good group here, and I think we're going to be making the best decisions for the students and staff members. Let's see. Yes, 1-to-1 policy. Yes, we need support for that.
So I'm trying to find, there is a,
were you able to bring up the Norfolk positivity rate just so we can kind of break those numbers down?
Give me a second. Let me stop sharing here.
Can I talk about the vaccines just for a few minutes?
Yeah, go ahead
while
and do
you're
that,
looking for that? Okay. So right now, a lot of health professionals are drinking water like from a fire hose because we're trying to understand exactly, you know, the vaccines that have been approved, how we're going to get the vaccines, how we're delivering the vaccines, what we're looking for as far as side effects, and the time between the vaccinations. So right now there are 2 vaccines. One, Pfizer has just gotten the FDA approval. I believe Moderna is either on the way or it's somewhere very close. They range between the first vaccination and the second vaccination, anywhere from 21 to 28 days between your first dose and second dose. And what they've seen in the studies is that most of your side effects, which they're calling, mild side effects, such as headache or body aches, that's coming when you get your second dose. Both of the vaccines the ones that are considered for being approved are not live vaccines. Okay, so they're not giving you the actual coronavirus. They're giving you pieces that will cause your body to make a response against the coronavirus, basically from allowing it to attach to your cells and replicate. That's a very important point, because I know that some individuals have concerns about receiving a live vaccination. So that's the first point. The second point is, right now the clinical trials have been done on folks 16 and up. The Pfizer vaccine is now in trials where they're doing children between 12 and 16. And so at this point in time, as far as United States goes, no children are participating right now in the clinical trials, but that is something that they are working on to get that underway, because obviously we're going to want to eventually vaccinate the children. We know that the risks for children when they are infected with the coronavirus are much less than individuals in the older portion of the age spectrum. Point number 3. The vaccine has to be transported in an ultra cold environment. And so how they're distributing the vaccine is another really quite difficult situation. And so what they're trying to figure out now is, how do they get the vaccine out to all of the your pharmacies, your healthcare providers, your hospitals, etc. And I think what the takeaway point is here is that the first providers to receive the vaccine are going to be your healthcare providers first. And supposedly we're going to be vaccinated sometime before the end of the month. And I believe that's with at least the first round of vaccine, maybe not necessarily the second round, because we're already at December the 13th. And then in the second wave, we're going to be looking at teachers and other individuals. And then by the third wave, hopefully the rest of the country will start to get vaccinated. Okay, so that's Norfolk, right? Great.
Yeah.
So let's break this down. So you have your color code chart here at the top: lowest, lower risk, moderate, higher, and highest risk. And so Norfolk right now, our percent positivity is 10.2%. So we are way out of the moderate risk zone, which is the yellow zone. If we were to go to the yellow zone would be a 5 to 8%. And we're at 10.2% right now. And our secondary indicators, which if you go down, so we're now at the red zone, which means that we're finding positive tests higher now than the previous 7 days. It looks like the percentage of our hospitals and our beds in the region, we're doing okay. But again, I'm just going to put a little caveat here. We can have the beds, but if we don't have the staff to maintain the beds, then that's a different situation. Yeah. And that's one of those things that, as somebody had said earlier, evidence-based medicine changes all the time. Well, these things change all the time. And there you go. There's our beautiful state. We are all red right now, sadly. And there's Norfolk, right?
In the last 14 days, we've had 344 cases.
Yes.
And when I kind of go look at Virginia Beach, it's 499, 383, Suffolk 492. And this is where I go back and I stress the point to folks is that all of our teachers and our staff members don't live in Norfolk. So we can't just use Norfolk's, because if we were in a bubble and everybody was just staying in Norfolk in their school, but they're traveling, and that's a concern. So I think that we are somewhat in the respect of saying that, hey, we could potentially move to this yellow because of the vaccine is now in play. And by that time, we should have some type of additional knowledge about that. But there are no other questions that we'll flush out during deliberation, during the meeting on Wednesday with that. I know I appreciate everybody. I mean, you folks are hanging in there with us this morning, and I'm trying to give 5 more minutes, Dr. Gabriel, try to answer some more of these questions, and then we can wrap up.
I can't see the questions from my standpoint, but maybe you can see the questions.
I'm gonna bring them up so that we can see them. I'm gonna stop sharing there, and I'm back in here. Somebody had said there was a question on Facebook Live from. I'm gonna say this one. Do you feel that the higher risk students that are trying to protect are the ones that may suffer the most from long-term risk, both mental and social economic, for not being in schools? So in other words, I'm gonna read that one again, and I'll try to find it up here. It says, and this is from Sharon Sadar, MD. I think this is that name sounds familiar. Was that in the paper article?
No, she's a Maury grad. I know Dr. Sader. She's an excellent physician. Her whole family, actually.
So I need to find out class of what? She's Maury, so she's already good. So do you feel that the higher risk students that we are trying to protect are the ones that may suffer the most from long-term risk, both mental and social economic, for not being in school? So being all virtual. Do you believe that they're going to still, we're trying to protect them by not having them physically in the building, but that they may have some long-term risk, both mental and social economic, from not being in school? So how are we trying to
nobody denies that nobody denies that that those children are suffering right now. Nobody denies that, and it's an awful situation. However, it is in this very delicate decision-making weighing risk and benefit that we have to be very cognizant of. And so while, yes, I think the board is making every effort possible in order to figure out a way to get those students in first, I think that we're at a level of comfort now, even transitioning possibly to, the yellow zone, that, we can do that. I also know that children are very resilient. And we will work very hard in order to make up for the time lost with those students. And it's extremely unfortunate, but I know that the dedication from our teaching staff and our board is there in order to really address those needs. The emotional needs, again, I'll just go back to the point of if there are items where they need to come and see their doctor, maybe to get into counseling, things like that, we can address. We cannot recreate sports teams. We can't, recreate, the social settings for children. And that's just going to come as the community does their part in order to bring the level of positivity down. Let's see, Jordan in particular. For some teachers, being willing to return only means that we can't afford to quit, and that we're that's, thank you for sharing that, because that's true. This is it's not even affording, this is what your health insurance is tied to. And so you feel like if you don't go to work, then how are you going to provide for your family? And I think it's important for everybody to understand not just the parents' perspective, but also the teacher's perspective. I mean, everybody has a valid point in this conversation.
Yeah, and I think we have
and Ms. Barnett, it's going to be for all students in the yellow zone, depending on the phase-in process. So if we adopt the yellow, if we adopt the moderate risk of transmission in school, that will first kick off with our phase 1 students, and then that will then go into the phase 2 and the phase 3 and the phase 4, depending on what the board decides on Wednesday with regards to the time in between the phases.
Definitely. And I'm going to bring in one because I want to make sure that we share that there is a.
Oh, yes.
Make this full screen so that everybody can see that, because we'd love for you all to participate in this. So the Virginia Department of Health and Dr. Gabriel, if you want to talk about that.
Right. So if anybody is interested to tune in, the Virginia Department of Health is going to host some excellent individuals who can speak about the vaccine, basically elaborate a lot on what I had shared earlier. They can talk about the decision to come to the types of vaccines that are being offered. They'll talk about distribution of the vaccine, side effects of the vaccine, and basically what it means for individuals in order to get vaccinated. And it looks like they're going to be answering questions. So, yep, for folks who want to tune in, this is a great resource.
Yeah, it looks like on Wednesday, December 16th at 7 o'clock. Well, it's going to look like it's happening at the same time as our school board meeting.
I know, right?
No,
When the meeting's going to be getting good too.
But I will say that it's going to probably broadcast and streaming, that I'm going to take it that it's going to be recorded and be available.
Probably.
And so I'll make sure that I share that out there. But definitely, our school board meeting is coming up this coming Wednesday. I think we have a work session prior to at 4, and then we'll start the meeting at 7 o'clock. You have until Tuesday to get public comment in. So if you want to share your comments, our clerk does a really good job of capturing all of those and making sure that they're posted to the docket, as well as if you want to send information to any of us through our emails and so forth. And I know I posted that there. I'll put this banner in for anybody who wants to get anything there. But Dr. Gabriel, you got any final thoughts?
Thank you, Carlos, for allowing me to participate with you this morning on this platform. I think it's a really great way to get information out to our community. I want to wish everybody a very happy holiday. I know the holidays are different for this year, but just remember to be thankful for your health, for the blessings that you do have in your lives. Share those blessings with others. Do what you can for your community and for the school division. And I wish for everyone to be safe, and I'm very much looking forward to what 2021 will bring.
I agree, Dr. Gabriel. There's not much more that I can really say other than we're going to continue to engage. We're going to continue to provide these opportunities. Even if you have groups, if you've got your PTA at your local school, or you've got your civic league, I know that I've offered to do Zoom meetings, and I know that Dr. Gabriel, you're out offering the same thing.
Yes.
If you've got questions, we are here to try to answer those, and most importantly, to take it back to the full board so that we can bring about action. We appreciate everything that 2020. I was watching something on social media where a guy was literally saying, I don't want to take back anything from 2020. And, as much as it's like we want to get rid of 2020, but there is something in everything. And throughout this has allowed a lot of us to be able to sit back, to come back from the everyday lives, and really to take in stock some of the things that we appreciate most. Our families, our communities, the folks that we're around. And so I'm looking forward to a great 2021. I'm looking forward to seeing our students continue to excel and to doing what's in the best interest of them and our staff members, and to see what this vaccine and everything has in store for us, and to see Norfolk Public Schools get to grow to higher heights. I think that's definitely something that we said when you got on the board, and even when I got there, is that as true NPS alums, proud products of the school division. We want just the very best for every one of our students to have the same experiences that we had when we came out of Norfolk Public Schools that we can be proud of. So with everyone, we want to say have a great Sunday. Have a happy holiday where you're doing Hanukkah, your Christmas is coming up, Kwanzaa, all of that together. We just say happy holidays to you all. And we appreciate you, and definitely tune into our school board meeting on Wednesday. So with that, everyone, have a great Sunday.